concept of using mobile stroke units is not new. You know, it started in the 80s, you know, I was in high school, you know, when these big names in neurology nowadays start thinking about linking ambulances with telemedicine or radio to hospitals. And it has evolved. So right now, a couple of studies in Germany, a couple of studies here in the United States have shown that is feasible to use radiology technology in a portable fashion to identify patients with stroke. So the concept is evolved already. Some large academic centers in the US are using it around the clock. My experience at Jefferson, we started our mobile stroke unit program in July of this year. We have seen at least 20 patients in the first month of inception, and we don't have a around the clock system yet, but I think, you know, this is how everything sort of like evolves. So you believe in the concept, you start introducing transformations or adaptations to your protocol, and you will see that in the future, right? Not having a mobile stroke unit would make no sense. It's like in the cardiac arrest world, not having available AEDs or available by standard CPR. It doesn't make sense in that particular chain of survival. So for a stroke, you know, a mobile stroke unit makes a lot of sense. So more and more academic centers will start using this, and you will see it. That will be like the standard in the years to come. Yes, there are a couple of epidemiological reports in the literature, the ones that I can quote, have been performed in the Carolinas, for example, in South and North Carolina, that have shown an increased mortality rate in the areas that have access to stroke expertise beyond 30 minutes. So it's impressive because the United States is a big country, and if you live far away, more than 30 minutes from a stroke center, and you have a stroke, you're more likely to die. So the only way, right, to fill in those gaps, you know, how do we bring patients that can get access to these interventions, right, is by the use of technology. And it's not just telemedicine. So, of course, mobile stroke units that can connect the patient before he or she hits the emergency department with a vascular neurologist. The transportation times, you know, so like very important. You know, are we going to use a terrestrial versus an aerial you know, mode of transportation for the patient? Which one buys more time? And of course, these are cost-effective decisions. So you have to think about, you know, the expense as well. But when it comes to talking about outcomes in stroke, they're really time dependent. So, you know, you just have to do it if you really believe in that.